Dr. Taiym again. I'm here with Kara Pfister.
Hello.
Kara Pfister is one of a few certified myofunctional therapists in the DFW area. She has a practice in Plano, correct? Off of 121 in Preston. And one of the things that we do at our office is screen for tongue ties. And why is it important to screen for tongue ties? Well, tongue ties can contribute to sleep issues, problems with speech, crowded teeth or malocclusion, and feeding issues. And Kara is paramount in helping us get our patients to better tongue function. And I wanted to ask you, Kara, what does it entail when you're assessing your patient on whether they are a candidate for a tongue tie release?
Sure. So the assessment involves taking a thorough case history, and also we do measurements, we do pictures, and most importantly, we do function. How is that tongue functioning within the oral cavity? What can it do? What can it not do? Swallowing and feeding are two of the biggest things that we also look at, and how they're maladapting because of the tissue that's connected. So once we find out that is truly something that is affecting them, then we need somebody to do the surgeries. And Dr. Taiym, I really appreciate how you do your surgeries, and I like the approach that you use. Do you want to tell us a little bit about how what you do and what approach you use?
Oh, thank you. Well, my approach is a little bit different. I've been doing tongue tie releases for close to 15 years, and most of that time it's been with conventional scissors, scalpel, and sutures or stitches. But I've incorporated the laser in my office, and I do some frenectomies with the laser. The problem that we run into with the laser, and Kara knows this all well too often, is there's a possibility or there's an increased likelihood of reattachment of the tongue tie release procedure. So what I do in most of my procedures, especially for the tongue tie release, I'm still going back to conventional scalpel, scissors, and stitches because I have full control about to where I can reapproximate the tissues, and that decreases the likelihood of reattachment. So when we do the tongue tie release, we send them over to you, Kara, and what do you do? What is your prescription of exercises that you prescribe to patients after a tongue tie release procedure?
Sure. So each individual patient is different, but most of the time we're going to need to re-educate the swallow for sure. And really their tongue resting posture is the biggest thing. Where is that tongue resting? Again, we can say it again and again and again. Function, function, function. How is that tongue functioning? So we're re-educating the function of the tongue. We're doing, that might involve stretches, and it might involve some feeding, learning how to swallow and manage their saliva. And a lot of it is the proper tongue resting posture. We need that tongue to be up in the roof of their mouth, resting properly so that they're managing their saliva, and really that's the biggest thing, is managing their saliva and what is their tongue doing on a daily basis, because that force is what causes the malocclusion, and that's what you see in your office. And with
Sure, yeah. Yeah, with a lot of Kara, you bring up a good point. When we're doing our orthodontics as well, and we don't have a proper tongue position, or there's a tongue thrust, that is probably one of the hardest things we do at our office, is trying to get the bite approximated well when we have an overactive tongue, or a tongue that's not properly positioned. And so I rely on you so much, because a lot of times if we don't address the tongue position, then we're going to get relapse. So that's great. Anything else you do as far as prescribing therapies?
It's so individualized, but the biggest deal is the stretching. We need to stretch those that tongue so that it doesn't reattach. Then after we get a few weeks of stretching, then we'll go into the actual re-education of the swallow, re-education of the speech, and re-education of the tongue resting posture. Those are the big three, and that because the force of that tongue really is what we need it to be up in the palate with the lips and cheeks and all the muscles of the face working together, so that we're not going to continue to have a relapse of the orthodontics that you do. So that's why I think myofunctional therapy and dentistry and orthodontics makes such a good team, is that you do your job, but then I can do my job, and it's all in the best interest of our patients.
Patient benefits in the long run.
Yeah.
Because, well, I mean, that's great. But thank you, Kara. Thank you so much for giving us a lot of information about how you can help a lot of our patients, and how you can help a lot of the individuals out there that may have a tongue thrust or improper tongue function. If parents want to contact you directly, what is the best way? Can you tell us a little bit?
Sure. We'll also post this down below, Dr. Taiym will.
Sure.
But you can call me directly at 214-274-9400, or I have a website, www.speechforfun.com. So I'd love to work together and
Which we are doing already. Yeah. I mean, we can't get the proper results without your help. So thank you so much. And thank you everyone for listening today. And please, if you have any questions, you can call Kara, or you can call our office. This is on our Facebook page, so you definitely have our contact info. Thank you, everyone.